Hello and welcome to tonight's Autism 200 series. Tonight is 203. We'll begin promptly at 7 p.m. Thanks for joining.
Good evening, everybody. I'm going to start us off here just briefly. I am Mendy Minjares. I'm the Executive Director at Seattle Children's Autism Center, and I'm playing two roles tonight. I'm going to briefly start us off because I'm the Seattle Children's team member who's hosting tonight's event, but I'm also going to be a member of our panel. So I am going to start us off by turning things over to Katie Bateman from University of Washington, who is going to moderate tonight's discussion. So take it away, Katie.
Thank you so much, Mendy. We are excited to be here today. My name is Katie Bateman, and I will be moderating tonight. I am a research scientist and a board-certified behavior analyst at the Herring Center for Inclusive Education at the University of Washington. My colleagues and I are excited to talk to you tonight about applied behavior analysis and engage in a discussion and answer some questions posed during this presentation. Before we jump into our presentation, I'd like to introduce you to our panelists. Dr. Mendy Minjares. Want to say hello again?
Hello again. Yeah. As I said, I'm Mendy Minjares. I am a licensed psychologist with a lot of background and training in applied behavior analysis. And I'm the executive director at Seattle Children's Autism Center and a faculty member in psychiatry and behavioral sciences at UW. I'm excited to be here with my colleagues from UW.
Thank you, Mendy. Dr. Nancy Rosenberg.
Hi, everybody. It's great to see everybody. I am Nancy Rosenberg. I am a teaching professor in the special ed department at the University of Washington. I'm also the director of the Applied Behavior Analysis program at the UW, and I am also the parent of an adult with autism who has benefited from ABA for many years.
Thank you.
And I'm a board certified behavior analyst.
Thank you, Nancy. Dr. Eileen Schwartz.
Hi, thank you for inviting me tonight, and thank you to everyone who's joining us for spending your time with us this evening. My name is Eileen Schwartz. I'm a professor in the College of Education at the University of Washington. I'm a board-certified behavior analyst, and I am the director of the Herring Center for Inclusive Education on the UW campus.
Great. Thank you so much, Eileen. So now we will jump into our presentation that Mindy will pull up, and then after that we'll do some questions and answering as a panel. Thank you.
Okay, so I'm going to start us off by just talking a little bit about what ABA is, what it is, and what it isn't. But before I even do that, I want to take off my professional hat and put on my parent hat and just talk a little bit about what ABA has been like for my family. I mentioned that I am the parent of a young man with autism. He's 28 years old now, and he has what I would call severe autism. He's significantly impacted. He still lives at home with us. He has limited verbal communication. He struggles to understand language. He needs help throughout the day to ensure his safety. But that's all of the things that he can't do. And there are so many things that he can do, so many skills that he has. He can do his chores. He can do his self-help skills. He goes to a job every day and has for 5 years. And all of the skills he has, I think we owe to ABA. So he was diagnosed when he was 2 years and 3 months. But we knew something was awry probably around 18 months. And we started intervention really early. And Brian had several therapies before ABA in between the years of 2 and 3, and they just weren't working. Brian wasn't responding. He wasn't responding to anything, and we felt he was just retreating more and more into kind of his private world away from us. And at about 3, we started ABA, and it was the first therapy that worked. It was the first intervention that enabled us to get Brian to respond to us. And it was through ABA that Brian said his first words. It was through ABA that he started to respond to simple directions. It was through ABA that he started demonstrating his first beginning play skills. So for a lot of kids, ABA acts as a jumpstart to more traditional learning. Through ABA, kids who aren't learning through traditional methods can gain the skills that they need, that they can then go on to learn in typical ways, in typical classrooms. Then there's some kids like Brian where ABA continues to be the key to their learning. And that really has been true with Brian. Even now, we use ABA to help him learn any new skill that he needs. ABA taught him to brush his teeth and get dressed. ABA taught him to play on his iPad and to use the remote on his TV. ABA is how we taught him the skills that he needed to do the job that he does now. If we look just recently, it was ABA that taught him to tolerate wearing a mask and now has taught him to put on his own mask. So more than anything, it's as a parent that I became such a believer in ABA and why I work now to teach ABA and teach people about the effectiveness of ABA, because I really feel it is what has given my son the happy and I really believe fulfilling life that he has now. So that's my my parent perspective on ABA. So now let's turn to, okay, this was this great thing that really helped. What is ABA? So ABA is, if I was to try to say it in one sentence, what ABA is, I would say it's a teaching methodology that utilizes the principles of behaviorism to help people change their behavior. That's kind of a big sentence. So let me try to unpack it. So first of all, I said that ABA is a teaching methodology. So that really is, ABA is something that we use to help people acquire skills that they want to acquire and change behaviors that they want to change. ABA is really good at breaking down complex skills that we often acquire in typical fashion with almost not knowing it, but individuals who are struggling to acquire them, it breaks down complex skills to make them easier to learn and works on the components of the skills systematically to help individuals learn. So let me give you an example of that. Just something that we all do probably every day without even thinking about it. And that is putting on a shoe. Think of like putting on a shoe with shoelaces. Again, we just do it. We don't think about it, but start thinking about what it involves. You pick up your shoe. You probably need to kind of loosen it, open it up a little bit. Then you probably stick your finger in the back of the heel to help you push your foot in. You probably, once you've got your foot in, you reach and you pull up the tongue of the shoe. Then you tighten the laces and then you tie it, which is its own really complex task. So this thing that seems simple for somebody who's struggling to learn it is actually a big complex set of actions. And ABA is really good at taking skills like that and breaking them down into manageable pieces and teaching somebody systematically to learn them. Another part of ABA being a teaching methodology is that embedded in ABA is the use of data, collecting data on how an individual is learning and constantly evaluating that data to make sure that what you're doing is working with the child. So did I break this down in a way that the child is learning? Are the strategies that I'm using working for this child? Okay, so that's how it's a teaching methodology. I said it's a teaching methodology that utilizes the principles of behaviorism to help people change their behavior. So what does that mean? So behaviorism is a science that has been around now for almost 100 years that studies the behavior of living organisms, really, but we're focusing on studying the behavior of humans. What causes people to engage in some behaviors, not engage in other behaviors? How do people learn? What maintains people's behavior? And how does the environment affect that? And it turns out through this science of behaviorism that there are basic laws that have been discovered of what changes and shapes human behavior in our environment. Laws, again, that have been studied now for decades. ABA takes these basic laws that are operating every day in our environment to shape all of our behavior and applies these in careful, systematic ways to help people increase behaviors or skills that are important to them and to decrease behaviors that they aren't happy with. So what are these basic laws? Let me just give you a couple of examples. So the basic behavioral principle that is utilized the most in ABA from the field of behaviorism is reinforcement. So decades of research have shown that if you follow a behavior, if a behavior of yours is followed in the environment by something that is reinforcing, that behavior is going to increase in frequency, or it's going to increase in the amount of times you do it. And lots of research has shown there's ways that reinforcement works more powerfully. There's ways that it will be less effective. Applied behavior analysis uses that research and study to use reinforcement effectively to help people change the behaviors that they want to change. Another basic principle, extinction. Extinction is a basic principle of behavior that says that if a behavior that has been reinforced stops getting reinforced, that behavior is going to decrease. And again, in the research world, this has been studied extensively, and people know how to use it in a way that it works and ways that may make it less effective. It's another principle that applied behavior analysts will use as part of their teaching methodology to help people decrease behaviors that they don't want anymore. So that, in a nutshell, is what applied behavior analysis is. Again, it's a teaching methodology, uses the principles of behaviorism to change behavior. So now let me talk a little bit about what ABA isn't, because there's some misconceptions out there, misinformation about what ABA is that I think just confuses people who are trying to make decisions about, is this a therapy that we want to use or isn't it? So the first thing that ABA isn't is it's not a curriculum. ABA doesn't tell us what to teach. It tells us how to teach. It's a teaching methodology. The only thing that the field of ABA tells us about what to teach is it is a basic tenet of ABA that we only use it. Anybody practicing ABA is ethically bound that they only use this technology to teach behaviors that are meaningful, important to the individual whose behavior is being changed. These principles are really powerful principles allowing us to change behavior. And so ABA says you only use these for important behaviors. But what's important varies from person to person, family to family, client to client, right? And so it is a conversation between a behavior analyst and a family about what behaviors are being targeted for change. Again, there is nothing in ABA that dictates that. Let me just give you one example from our own life to give you an example, to just give you a flavor for how ABA can really be individualized to what's important to you. I've told you that my son is significantly affected, and it was pretty clear early on that he was pretty significantly impacted by his autism. I, as a parent, it didn't bother me that much that he couldn't name his colors the way other kids could. It didn't bother me that much that he couldn't put shapes in a shape sorter. What really bothered me was that at holidays, he couldn't engage with us. It's really when his autism made me feel really sad. When I'd see him at Christmas or at a birthday, when somebody would give him a gift and he would just wander away, not understanding what that was about. I just remember Easter egg hunts in the early days. It was a holiday we celebrated, and all the kids like running around looking for Easter eggs, and Brian just kind of off on the side, not even aware of what was going on. Those were things that mattered to us as a family, and I believed would make Brian's life better if he could do them. So we had instructional programs. We had a gift opening program for Brian. We had an Easter egg hunt program to teach him to do those things so that he could experience them and enjoy them and be part of the family. So those were completely individual to us. Another family might not care. But again, if anybody says that ABA is dictating that you do or teach certain things, that is incorrect. ABA does not say what to teach. It only says how to teach it. Okay, so that's one thing that ABA isn't. It's not a curriculum. Next, it is not just a therapy for kids with autism. It has become associated with autism, but ABA, again, is based on principles of human behavior. And so ABA can be applied to any human, any adult, any child, a typically developing person, a person with disability, a person with a different disability, a person with autism. Why has it become so associated with autism? It's probably because so much research has been done on ABA with kids with autism. It started in the 1980s, a study that came out in 1987 by Ivar Lovaas, where he used intensive ABA with a group of kids with autism and showed some pretty significant results, especially compared to a control group of kids who weren't getting intervention. In the 20 years after that, there's a number of follow-up studies of groups of kids with autism that showed ABA to be really effective for those kids. And so that research was being done just with kids with autism. They just weren't doing the research with other groups. And so ABA became determined as an evidence-based and probably the most effective evidence-based practice for kids with autism because of all this research that had been done. We advocates and parents and lawyers were able to get insurance companies to cover ABA for kids with autism because of all this research that had been done. And so that's how it became associated with autism. But it doesn't mean it doesn't work with other groups. It just doesn't. It just means that long line of research hasn't been done with those other groups. Okay, so it's not a curriculum. It's not a therapy just for kids with autism. The last thing I wanted to say, and then I'll pass it on to another colleague, is it isn't just one teaching approach. And most specifically, it is not discrete trial training, if you're familiar with that. Discrete trial training is one strategy within the teaching methodology of ABA. And it's a strategy where you really pare back learning to the bare essentials of you teach a child a cue or an instruction and teach them a response to that cue or instruction, and you reinforce it. And you practice that. And some kids need that. My child, I told you he wasn't being successful with a lot of different therapies. That's what he needed at first, was that paring learning down to its bare essentials. But you only do that if you need it. There's lots of kids on the autism spectrum that can learn from much more naturalistic ABA strategies, and that's what you should be using if they're successful. The basic rule is that you use the most natural, least restrictive strategies that you can, only stepping back to something as structured and kind of isolated as discrete trial training, if that's what you need to get the child jump started in their learning. So let me just review again. It's ABA is a teaching methodology that uses the principles of behaviorism to change behavior. It's not a curriculum. It's not just a therapy for kids with autism. And it's not just one teaching approach. It's a collection of teaching strategies, all using the principles of behaviorism to change behavior. So I hope that gives you a somewhat of an introduction to what is actually a very complicated topic. And now I'm going to turn it over to my colleague Eileen Schwartz to talk about some common criticisms of ABA treatment.
Great. Thank you, Nancy. And so I've been practicing applied behavior analysis since the late 1970s. I had an amazing opportunity when I was in college to work with some of the pioneers in applied behavior analysis. And I spent every afternoon of my senior year in college working one-on-one with young people with autism in a clinic room at UC Santa Barbara. So learned a lot of work and I've seen a lot of things in the past 40 years about things that have worked well for applied behavior analysis and things that haven't worked well. And the thing about applied behavior analysis is that we are a relatively young field. So the field really started in 1968. And so our premier journal in applied behavior analysis is called the Journal of Applied Behavior Analysis. And the first issue of that was published in 1968. So we're a young field. It's a optimistic field. It's a field that was developed because people said, we have this technology, this instructional technology that can help us change behavior. And that's an amazing thing because we can teach people who in the past people said could not learn. And we can teach them new skills. Remember that in the 1960s, if you think about what was happening then, that people, when children were, let's take the example of children with Down syndrome. When children with Down syndrome were born, parents were often told to put their children in institutions. Well, strategies of applied behavior analysis were used with children with Down syndrome to answer the question, can these children learn? And absolutely they can. So people don't do that now. So there's some amazing things that applied behavior analysis has done, have really changed the way that we think about learning for all people, people with and without disabilities. But there are also things, because we're a young field and we're learning, that we haven't done well. And there are some common criticisms. So one of the criticisms is that people think, often will say, that ABA has a disrespect for neurodiversity and individuality. And I think that's a very fair criticism. I think that the study that Nancy cited, the Lovaas study in 1987, Lovaas talks about he was able to cure children with autism. Now, some people we've learned a lot about autism, and we don't want to necessarily cure children or people with autism. What we want to do is teach people with autism, teach people across the spectrum of all of abilities, skills that will help make them successful and help demonstrate and help them achieve the improved quality of life that they and their families define. But in the earlier days, did people say that's a behavior and it needs to go? Absolutely. And now I think we're learning, and when we're training the new behavior analysts with whom we work, we talk a lot about saying what is important to the person with disabilities and the family of the person with disabilities. And those are the skills that we should be working on. Like Nancy said, applied behavior analysis is science that uses the principles of behavior to address socially important problems. And those socially important problems are defined by clients and their families, not by the practitioner. The second question is common criticism is a lack of attention to culture and individual priorities. Again, I think that there are many educational practices, psychological practices that are guilty of this. And I think applied behavior analysis is also guilty of this. And again, one of the things that I can say now, since I've been working in applied behavior analysis for over 40 years, that the way I see people addressing diverse families now is really different than even how they did 5 years ago. But what I love about applied behavior analysis is, number one, it's inherent optimism. And number two, it's inherent need for families to identify the socially important behaviors that are going to be addressed. And by requiring that families and individuals identify those socially important behaviors, it requires us to listen to and respond to what families are telling us. Do we have a lot of work to do still in making sure that families who have been historically marginalized are no longer marginalized? We absolutely do. And I think that's an area in which I see the field working hard to move forward on. The third area that I see lots of criticism about is rigidity of program. One of the things that, and I think Nancy addressed that beautifully, one of the things I've learned from working with Nancy for so long is to just go after her, and then she makes all the really important points, and I don't have to. So I love that. But what Nancy said that was so important to remember is that ABA is not a curriculum. So when people say there's a rigidity of programming that you have to learn A, B, or C, well, no, that's not necessarily true. Now, what we do have in applied behavior analysis, as you should have in any good educational or program, is we have a number of assessments, and those assessments sometimes will lead to a curriculum. But again, those assessments tell us what a child can't do, but families and individuals tell us what they want the client to do. So if I have a child who doesn't know how to, can't read particular sight words, and the family says, you know what, I'm not worried about that because I'd rather work on having my child learn how to listen to recorded material on his iPhone, and then be able to answer comprehension questions. That's great. We can work on that. So assessments and curricula are one kind of information that we can use to develop curricula, to develop a intervention plan for an individual, but they're not the only one. One of the things that we always talk about when we're developing plans for people with autism is that we want to make sure that we work on the on people's strengths as well as their areas of need. Again, I've been working with families for a long time, and one of the things that families tell me is, you don't need to tell me what my child can't do. I'm very aware of what my child can't do. And yes, I want to work on some of those things. But more importantly, let's think about what your child can do. Let's think about some strength-based programming. You have a child who likes to draw, great. Let's make sure they can have art lessons, and let's make sure that they can develop that skill in a way that they want to do it. They like music. Let's see if we can get them music lessons. You have a great swimmer. Let's get them on the swim team. They don't need to be on the special ed swim team just because they have autism. They can be let's just make sure they can participate in the regular swim team and figure out if they need support there to be successful. Let's do that. But thinking about what children need to learn in terms of areas of weakness, but also building on those strengths. That's super important, because who would want to spend 6 hours a day or 10 hours a day or however many hours a day working on things that you are bad at? I certainly would not want to do that. And finally, there's been a lot of talk from people who have a lived experience of having ABA treatment, and we value the voices of those people. Some of those people tell us great things. Again, I've run a preschool, an ABA-based preschool for kids with autism since 1997 at the Herring Center. And I have students who have graduated from that program who are married, who've graduated from college. And I also have students who've graduated from that program who still have very intensive support needs. I've had people who tell me that they had great experiences with ABA, but we also hear that from many voices of people who did not have good experiences. And I want to hear those voices, because when I hear someone tell me that they had a bad experience with ABA, then what I want to do is hear what they have to say. And I call that social validity. Social validity is an idea that comes out of applied behavior analysis, where we want to understand what the intervention means in a social sense to the person experiencing the intervention. So if someone has a bad experience and I need to figure out why, and then figure out how I can change, how I can work with people to change the intervention so that no one else has that same experience. So with that, I'm going to turn it over to Mendy. And thank you again for inviting me this evening.
Okay, thank you. Wow, when we made the order of speakers, following Eileen and Nancy was not something that occurred to me would really put me in the hot seat, but here we go. That was great. Thanks, you guys. I find both of your guys' comments really, really helpful. Nancy, I think you did such a nice job kind of just really, clearly laying out like, hey, here's what ABA is. It's this teaching methodology. Yes, it's an incredibly complex field, but it sort of does boil down to it's a way that we teach behavior. And Eileen, going through and sort of clarifying those, some of the sort of facts and myths, I think is really useful for families. And so what I want to talk about, you guys, hopefully kind of have some sense now, you guys meaning the audience, hopefully kind of have some sense now for just, some of this general information, some of the general kind of pros and cons. And I want to talk about then how, families, how parents in particular, but anybody who's a consumer of ABA who has the ability to, to self-advocate or advocate for someone in their life, can make sure that, the kinds of things that we're saying tonight should be happening are happening. So how do you know if ABA interventions that are, being delivered to your child or to your family are a good fit for your family? How do you assess the quality? How do you be a good consumer of ABA? Because I think this is really challenging for families. It's no different than going to a medical specialist or into any other kind of a setting where you're receiving a highly specialized treatment. We don't expect families to have that knowledge necessarily, but then you end up in this situation where you really may, end up feeling marginalized or feel like you don't know how to advocate. And so I'm going to spend a few slides here kind of talking a bit about some of this kind of information. So, when we're talking about goodness of fit, Eileen and Nancy did such a good job highlighting, both kind of the ethical obligations that are front and center in the field of behavior analysis about how we pick the behaviors that we're changing and how that technology gets applied in an ethical fashion. One of the most important pieces, which we've already heard, is the family and the patient having input. So there are, there's stacks of literature written about how to do this. There are even like person-centered planning I have listed here. This is actually sort of a formal process that, one can use. It's not just specific to ABA. It's a broader set of principles that are really focused around how do we plan, for the life of an individual who needs support, and how do we make sure that they remain at the center of that and that they can advocate for themselves to whatever degree, they're capable of doing so. I think something I talk with families about all the time, and I think I've heard you, Eileen, say in other talks, any ABA program that doesn't have family involvement or training, again, like there's that would run counter to the way in which we should be working. The very notion that a family would somehow be excluded from therapy is not the standard in the field of ABA. So it's not only that the family would have the input like we've heard about, but also that the family could learn the tools, that the family could, when we're talking about children or adults who need support, that the family could learn the tools that the therapists are using to be empowered themselves to support the individual in their family and to enhance the entire family's quality of life and make sure those skills are carried through when the therapists aren't there. And, there's just an incredible amount of importance. And the last point I make under the family and patient input sort of category is this idea about transparency. Like when I'm doing parent training with families that are in the ABA program that I work in, I say to families, you should be able to walk into your, ABA therapist's office, and you should be able to ask any question. You should be able to ask them to see the treatment programs, to see the goals, the data that are being collected, to watch the therapy. And if there's some kind of closed door policies happening, if there are like, oh, parents can't have access to that kind of things happening, again, this is just a, kind of a red flag that ABA is not being practiced in a person-centered and a family-centered fashion, which is, again, not considered the standard in the field. Eileen kind of mentioned the next two points to a certain extent, ecological validity and social validity. And these are the idea, ecological validity is the idea that not just the goals, but also the way in which we're working should be feasible and should be a good fit in the natural environment. So we heard Nancy say at the beginning, talk about how the default should be for the intervention to be as naturalistic as possible, and that we only move up to more restrictive interventions when we need to in order to teach skills. And so one of the things that we really have to consider is, what is the feasibility of implementing the interventions that we need to implement in the natural environment? And are those things going to be feasible? And then also, what is to what extent is the behavior that we're teaching a good fit with the environment? And so this then gets also to the social validity. So in social validity, we kind of talk about the social importance or the acceptability from the perspective of the stakeholder, meaning the patient or student, the family, the folks who are involved, and the way in which the behaviors that we're teaching fit into that setting. So an example, when I was a graduate student, also at UCSB actually, but Eileen is far more experienced in the field than I am, so we were not there at the same time. But we always used to joke about, because we did a lot of school-based interventions, and we would joke about, like, how do you teach kids to approach other kids on the playground? It is not by walking up and saying, like, hi, my name is Johnny. Can I play with you? Like, if you go to a playground, this is not how kids approach one another, right? So this is a skill we could teach, but it doesn't have social validity. It doesn't have social acceptability for that setting. Instead, we might teach kids to walk up to a group of kids and imitate what they're doing. That's a really common way that kids join play. And I think one of the things that's really important about this notion of social validity is that it's the perspective of the individual and the family that gets prioritized over the expectations of society. And so I think this also goes back to, like, Nancy's examples about gift opening, for example, versus learning colors. Social validity is not meant to be something that defines the way in which people with autism need to conform to society's social norms. That is not what social validity means. And I think that's sort of another myth in autism. Like, we're trying to take individuals that have, differences or that are neurodiverse and kind of make them conform, or make them, normal or neurotypical or indistinguishable from their peers, is something a phrase you hear a lot. And this is not the definition of social validity. The definition of social validity is it important to the individual and to the family or to the context in which this person wants to function? And so this is a really important distinction. And then the last one, which I think Eileen, highlighted really nicely, is the cultural validity. A simple example of this one is, people raise a lot of questions. A lot of questions get raised in general about targeting eye contact in ABA, because this is an example of a behavior that could be, that is often defined by autistic advocates as being something that requires them to conform to a norm that they shouldn't have to conform to. And that may very well be true in many cases. I think it's highly variable depending on context, but it's also such a culturally laden behavior, right? And what eye contact means in one culture versus another, and how it's used in one culture versus another, can be so variable. And that's true, of course, of all social communication behaviors. And so when we're setting goals, and also when we're deciding on intervention strategies, we really have to be thinking about the cultural context of the family and the cultural context in which the individual is functioning when we're doing that treatment planning. And again, these are all standard. These kinds of characteristics should be standard practice. And so I think they have not always been standard practice. They've evolved a lot, and I think they've been redefined and reiterated over the years in a way that has resulted in a lot of these improvements that, Eileen kind of talked about when she talked about the history. And I think we still have, work to do, but they are very much front and center in how we practice, currently and certainly going forward. And so again, I always like for parents and consumers of ABA to know, like, try to have this lens, try to ask questions about this, be thinking about how does your program fit for you? And are these factors being taken into consideration? And if not, then ask why. Start the dialogue with the providers. In terms of setting goals, I think this is, we've actually touched on a lot of these features, I think, tonight. So I may, kind of skim through this fairly quickly. But again, we've heard from Eileen and Nancy already about the way in which we should be thinking about what we're going to teach. We don't want to teach skills that aren't going to be functional to the individual. We don't want to teach skills that aren't useful and don't improve quality of life. We want to teach skills that once they're learned in the therapy setting can be generalized to other settings and again are useful in those settings. I think another common criticism of ABA is like, well, you just sort of train the child up to be a robot. They do the skills for the therapist, but they don't actually know how to use the skills out in the, in real life. And programming for that generalization, which means can the child transfer the skills into real life, should be a part of the ABA program. And if that's not happening, then that is a therapy problem to be solved by the behavior therapist. The goals should be, developmentally appropriate. So I think to some extent we have a history in ABA of kind of, teaching skills to kids because they should be at a certain stage by a certain point in time, but we end up missing prerequisite skills or not really accounting for, what a child who's 4 but is functioning more like a 2-year-old, what they actually need to scaffold their development up. And again, ABA is not a curriculum, but the skills of a strong clinician are to work together with a family to figure out, okay, you want your child to communicate. We're going to help what are the developmentally appropriate skills that we need to scaffold up to teach communication. I talked on the previous slide about social validity and cultural validity. And then again, I think, when we're setting goals, we're focused on quality of life. ABA is not, a goal of ABA is not to make an individual turn into someone neurotypical, to be indistinguishable from their peers. Again, these kinds of things I think are common criticisms or misconceptions. The goal of ABA is to improve people's lives. And Nancy gave some really nice examples of that at the beginning. It's to make people, better able to access environments that they want to be in, better able to participate in activities they want to participate in, to have dignity, to have independence. And this is a quality of life focus, not a conforming to social norms kind of a focus. So this is a little bit more of a slightly technical slide, but I do like to go into this information a little bit. Like really the background of this slide requires like a whole nother lecture on what ABA is. But if you'll kind of bear with me, especially for parents who are listening, I find that when we discharge families from our ABA program at Seattle Children's, that one of the big challenges they have is they go out into the community looking for longer term ABA, because ours is sort of a short-term model that's meant to kind of really teach the families a lot of intensive skills up front and really evaluate the child in a very comprehensive way and start jumpstarting their skills. But then we discharge them into long-term ABA. And one of the things that happens, I think a lot, is then parents are out in the community, they're calling agencies, they're talking to providers, and they're really struggling to understand what they're getting as a service, what the quality of that service is, that kind of thing. And so what's on this slide is some sort of like very cornerstone components that should be present in an ABA program. And again, to know why they should be present or to have all the background is like, you have to go get a master's with Nancy and Eileen. But they're things that parents can pretty easily evaluate whether these features are present or not. So the first one is just having a clear treatment plan that has clear goals and objectives. And like Nancy said, ABA is a teaching methodology that is meant to teach skills, to teach behaviors. And so I always tell parents, when you're looking at goals, you need to look and see what is the behavior being taught. Like, would we all agree, would everyone on this panel, if we were watching that child, would we be able to agree that that behavior has or has not occurred? And so an example is, to say that communication is going to be taught is not a clear behavior. You can't pick a behavior out of that. Communication is an entire skill set, right? And a skill set that actually or a word that can actually mean lots of different things. A clear communication behavior is pointing to an object to request that object, or handing an object to someone to receive help from them, or using your words to say, I'm all done, right? Those are clear communication behaviors. And so I try to kind of go through goals with families and teach them, like, how do you evaluate, is this a clear goal? And then within that goal, will we know that when it's met, which is what we mean by mastery criteria. So if we just say, we're going to teach you to point to request objects, once you've pointed once, have we met the goal? Like, do you have to point 150 times in an hour? Like, what's the way that we define, yes, you've got it? And how that gets defined is a whole complicated area of ABA. But you can usually tell whether it's present or not because there's some kind of criteria, like 80% of the time across 10 opportunities to request something that you want, for example. Right there, you can start pulling out, 80% across 10 opportunities. Okay, that starts to sound more clear, right? And I don't think that parents or people that aren't trained in ABA have to have, a vast amount of underlying knowledge to be able to kind of look at a goal and say, I can see what's being taught and I can see how to tell when the goal is met. And those things are hallmarks of a good ABA treatment plan. Clearly written teaching programs is something that is typically not given to parents in a lot of cases. And so parents don't realize that these exist. And again, I really encourage parents to know this and to ask about it. Because like Nancy talked about, ABA is so good at systematically breaking down teaching, right? Like that is such the crux of how we do things in ABA. And so what that means is for every single behavior that we teach, there is like a very clearly delineated teaching program. And so that would be like a written document, piece of paper of some sort, a table or a grid that would say, here's how you set up the teaching. Here are the materials you might use for the teaching. Here's how you're going to prompt the child to use this behavior. Here are the reinforcement strategies being used. Here are the error correction strategies being used. Here, and it's so clear that like any ABA therapist should be able to walk in and go, all right, I see how we're teaching this child this skill. And so this isn't part of the treatment plan, like maybe like the intake assessment that a family might receive, but this is part of what the therapists use to teach. And I think this is a really, really nice way for families to see, like, is your agency being systematic? Are they being really consistent in their teaching? Because again, these things are cornerstones of ABA. Ongoing data collection and the next one, database decision-making. These are like entire areas of ABA that are like entire, college courses. But the reason I bring them up is because the way that we do all that systematic teaching in ABA and the way that we decide if it's working or not is by taking data on the child's performance on everything that we're doing. So this, again, is a cornerstone of ABA. The term applied behavior analysis, the analysis part of it means taking data and analyzing those data in a scientific manner to see if what we're doing is working so that we can clearly say, this intervention is clearly tied to this behavior change. It worked. And we don't ever in ABA say like, gosh, this child seems to be doing a lot better in treatment. We say, show me the data. I want the proof. Like I want to see it on paper. And so to go back to the pointing example, if we set up opportunities 10 times in a day for a child to point to something, maybe by holding up an object or offering them something, every time we're going to document their performance. Yep, they did it. No, they didn't do it. They needed help. They had a challenging behavior instead. What did they do? And then at the end of a teaching session, we're going to be able to have some good information about how they're doing, like the percent of times that they performed the skill correctly, or the amount of the time that they responded with disruptive behavior. And then we can tie that information to our decisions about what to do next. So this data-based decision-making is kind of a buzz term in ABA. How do we decide what we're going to do next? We decide based on the data. And so again, I always encourage parents, ask to see the data, ask to look at the graphs. Like, looking at a graph is a very nice, clear way to see your progress, right? Leafing through data sheets can be sort of confusing and convoluted, but like, oh, look at this nice line that shows that my pointing behavior is improving. That's really easy to look at. You don't need a high level of training to understand what that means. And I think that's really great information for parents to be able to say, show me the data, demonstrate to me what's happening in treatment and why it's working. And then the last thing that I always like for parents to know about is there's a pretty standard way in the field of ABA that the treatment team gets set up. And this is because, oftentimes ABA is a lot of hours. It can be a very intensive intervention. And so the board certified behavior analyst, which is usually a master's or a doctoral level, clinician, is not necessarily the person that delivers all those hours. That level of expertise does not necessarily need to be present for all the hours of the therapy. And so in ABA, there is a role called a behavior technician, and in Washington, the license for it is called a certified behavior technician. And this is usually a person that's at a bachelor's degree level who's really good at implementing the programming. Like, the behavior technicians are the ones who are like creative and fun and making it, motivating for the child. And they know how to run the programs really systematically. They're really good at that implementation. But they don't necessarily have the training to say, what skill are we going to teach next? Or why isn't this working? Or what are we going to do about this challenging behavior that has emerged? That's the role of the BCBA, or the master's or doctoral level therapist. And so typically there's a team with like one or more behavior technicians supervised by this board certified behavior analyst, which you heard at the beginning, Katie and Nancy and Eileen all talking about that credential. And I think it's really important for parents to realize, by law and by ethical standards in the field, that supervision has to be a minimum of 5% of the child's time in treatment. And oftentimes what ends up happening, because the field is growing so rapidly, therapists are overtaxed, caseloads get too big. Like, sometimes that supervision can slip through the cracks, or things get disorganized. Someone's caseload is too big. Someone quits and their agency's trying to hire someone new. There's all kinds of things that interfere with this. But you really want to make sure that your behavior technicians are receiving the proper supervision so that everybody's working together as a team and you have all the right expertise involved. And so this is another piece that I oftentimes talk to parents about. So to kind of wrap us up, I wanted to just talk here at the end about kind of some current and future directions in ABA. I mean, this is almost sort of like, piggybacks on the history that Eileen gave us and a lot of the, improvements that she has noted. And I think the field of ABA has really come a long way in, thinking about how we teach, the context in which we teach, this idea that we should be teaching as naturalistically as possible, and the types of skills that we teach, and so on and so forth. And I think one of the, things that has happened along the way is that ABA is doing a much better job then of, kind of taking into account the importance of a child's engagement in therapy, their motivation. I think ABA, naturalistic teaching strategies as a field has really come to focus much more on kind of child-led instead of adult-led therapies. And what we mean by that is, that the child essentially gets to define the interests and the reinforcers that they want to work for, but also just maybe the activities that they're going to engage in. And then it's the job of the therapist to embed that teaching in. That is, the difference between naturalistic interventions and kind of more of that discrete trial format like Nancy was talking about at the beginning. And there's all sorts of reasons why this then promotes a lot more autonomy, choice, control for the individual, and is certainly more, motivating and fun and engaging. It's much more developmentally similar to what happens in preschool or other contexts that typically developing, kids may be functioning in. And I think the field has just evolved immensely in this way. Discrete trial teaching is one tool, but it's not the only tool. We have many, many tools in the toolbox, like Nancy had mentioned at the beginning. I do think, like I said, that, the field is much more focused on developmentally appropriate, really functional, like very socially and culturally valid goals. Do we still have work to do as a field? Yes, absolutely. But, somebody said in a talk I went to recently, something to the effect of, when you know more, you do better. And I think the field of ABA is being very responsive in that way. And I think we're really in a very, optimistic and sort of positive phase as we, the current status and kind of going forward. And then one of the things I think that's really becoming a practice that's being highlighted a lot more is one of the ways to have social and ecological validity is to get input from adult autistic individuals. And I think this is another place where there's an unnecessary divide or a misconception about the divide, that folks in the ABA field maybe aren't open to that. But I mean, as we heard from Eileen tonight, what her perspective is on the importance of input and views from many different people who've received ABA. I think we as a field have much to learn from gathering that input, and I'm sure would continue to adapt our practices accordingly. And I think we're really, I just reviewed a paper for a journal actually, where there was a kind of a set of recommendations made about how ABA programs can account better for neurodiversity and, kind of these kinds of issues. And one of the recommendations was, ABA therapists should routinely consult with adult autistics for their input. And I think that's a really valid recommendation. So the last thing I want to do, I put up some resources here. And the reason I included these particular resources is because this is a kind of a combination or a cluster of different ABA-based models that are naturalistic. And I think this information often gets very overlooked in the field of ABA because ABA gets misdefined as being just discrete trial teaching, like Nancy mentioned at the beginning, when in fact, ABA consists of a large repertoire of teaching methodology. And so on the one hand, while this might be confusing because it's a number of different models and like which one is right for me, on the other hand, there is a great deal of overlap among these models. And really what it kind of boils down to is that there are actually many models available that can guide clinicians and parents about how to do ABA in this naturalistic, very individual focused fashion like we're talking about tonight. And these are some good resources. So I put these up, just to kind of, provide that broader perspective. So with that, I think we are ready I think we have about a half an hour left for questions. So that should give us like a good amount of padding. So I'll turn it back to you, Katie.
Awesome. Thank you so much, Mindy. So one of our questions that I think is a good piggyback is about choosing providers that are right for a family member. So how do families choose providers that are right for them?
Oh, Eileen, I think you might be.
I'd be happy to take that on.
Yeah.
So, when we think about providers, we think about them in the same. I like to think about them in the same way that we think about other medical providers, or how do you choose a doctor? How do you choose even someone that works for you? Because you want to remember that they're your employee, especially the behavior techs that Mindy talked about, because especially if you're going to have home-based therapy, these people are going to be in your home for many hours a week. So I always want to say to families that you remember that the behavior tech and the BCBA may know more about behavior analysis than you do, but you know more about your child than they do. And any provider that didn't answer my questions, that didn't want to show me the data, that didn't take my listen to my concerns, to me those are red flags, and I would be very hesitant to work with that provider. I think it's very important to think about, do I feel like I can ask that person a question? Do I feel like they hear me when I say I'm concerned about how that program is going? When people tell me that their child doesn't like the behavior therapy, then I'm saying then there's a problem there, because it has to be fun and engaging. And you're doing it a long time. Most times when I see the therapist going into homes, kids are running to the therapist. And sometimes one of the problems that parents will tell me is that a typically developing child will be upset that they can't participate. And what we always say is then come on in, let's do some group work. It's wonderful to have, the more the merrier. So, but that would be the biggest red flag to me. And it's also important then that BCBAs and families are not a one size fits all. So someone that is a great fit for you and your family may not be a great fit for your neighbor and their family. So talk to people, get recommendations, and trust your gut. It's your child, and you are the expert on your child.
Great.
Katie, if I could maybe just add quickly to that. I mean, that's, ditto to everything Eileen just said. And I think maybe the piece I would also add is when I'm like the slide I went through with kind of those, characteristics of actual ABA programs, like the data and the graphing. And when I'm teaching that information to families, I try to empower them with here are questions you can ask. Ask, how often do you take data? How do you do it? How often do you graph it? When does the BCBA look at it? I mean, there's many, many questions you could ask about those things. And I try to really empower parents, be an active participant in that way. Don't be a passive, participant where you're sort of assuming the expert is going to dictate to you. Be a partner. And part of being a partner is asking questions and then feeling satisfied with the answer. And even though the field of ABA is really complicated in terms of how things are taught and et cetera, the answer to questions that parents are going to have, I think, are typically should not be that complicated. And that's where the trust your gut comes in. If it doesn't make sense to you, if it doesn't add up, if you don't feel like you got the answer, then I think that's information for you. And so I just really encourage parents to be active in that way, and to don't wait for your team to partner with you. Take those steps proactively and partner with them.
Thanks, Mindy. Next question is around sensory processing issues in autism. Does ABA consider that the child's behavior is being influenced by their internal state? In the example of the child not wanting to participate in the Easter egg hunt, isn't it possible the child is avoiding it because they are overwhelmed with the noise, crowds, kids bumping into them?
I'll take that since I talked about the Easter egg hunt. And I love this question. Thank you to whoever asked it. Because I think, as Eileen was talking about how ABA has changed over the years and how in the early days things weren't done the way we do them now, I don't think we thought enough about the sensory issues of kids and did tend to just try to teach behaviors that required kids to just plow through. But in this example with the Easter egg hunt, it is possible that the child is avoiding it because my son was avoiding it because he was overwhelmed with the noise, the crowds, the kids bumping into him. But it's also possible that he was not doing it because he didn't have the skills. He had no idea what they were doing or why they were doing it. And so how I think about it is we teach them, make sure they have the skills to engage. We make sure they understand the motivations to engage, and then let them choose. So for example, we had to, most kids are motivated to engage in an Easter egg hunt because they see other kids engaging in it and they want to do the same thing. That wasn't necessarily what drove Brian. So we first had to teach him that if you find one of these plastic eggs and you open it, there's going to be something you want inside. And so our first step, I talked about how we break things down, complex things like engaging in an Easter egg hunt, into simple steps. Our first step was to teach him how to open one of those plastic eggs and find the jelly bean inside. And other kids might have found money, which wasn't motivating to them. Brian found jelly beans. So that was the first step of the program. Then we had to teach him how to look for eggs. And for Brian, it was first just having an egg 2 feet in front of him that he would actually go and get and open up and get that jelly bean. And then making it a little further away, and then teaching him you had to look behind things, until in a calm environment, he could go around looking for eggs, knowing that he wanted to find these eggs, knowing it was fun to find these eggs, and put them in his basket. Now he has the skills. Next year, we take him to the Easter egg hunt. He has the skills. He knows why you would do this. We let him choose whether he wants to do it or not. If it's too overwhelming for him, we'll have a private, quiet Easter egg hunt later on. But if he wants to do it, he now can do it. And so that's the approach I think we should take, because if we just assume, oh, they're too overwhelmed, then we overlook the fact that actually they might just not have the skills they need. And so that's kind of the approach that we take with a lot of things. Let's make sure they have the skills, and then let them navigate what their sensory system will let them engage with.
Great. Thank you so much, Nancy.
Yep.
Our next question is, do all autistics need ABA? Describe when ABA is medically necessary.
Maybe I can, since I work in the medical setting, I was going to say maybe I can take this one. I'm seeing some nods from my education colleagues. So I think this is a really tough issue. I actually worked with the Washington State Healthcare Authority on development of the ABA benefit when they started covering ABA back in 2013. And they wanted us to develop criteria, like you only need ABA if. But I think we have to go back to what Nancy said at the beginning. ABA is a teaching methodology. And so I think that anybody who needs to learn skills to improve their quality of life or decrease challenging behaviors to improve their quality of life, where those skills or challenging behaviors, can be reasonably directly tied to a condition like autism, that is medically necessary. And I don't think that we, are in a position where we should be evaluating the magnitude of that or the importance of that, because that is then for like insurance companies to start to, make decisions for families, for example, on the importance of something or the way in which something is impairing a family, which is something an insurance company can really have no knowledge of. So although an individual might have a lot of good skills, maybe, have communication skills that are on par with their peer group, or cognitive skills that are on par with their peer group, and so on paper, they pencil out from assessment or whatnot, like a child who maybe doesn't need intervention, so, quote unquote, but they have, one specific set of skill deficits that's getting in the way. They won't engage in certain daily living skill routines. They won't take a shower, or they won't brush their teeth, or they won't go into a specific setting that they really need to be able to go into. Like they won't go into a public bathroom. Their sensory and other, difficulties are interfering with being able to use a public bathroom. And so suddenly the family's world narrows down because we can't ever go anywhere without coming back home to go to the bathroom, for example. All those kinds of, challenges are pretty reasonably tied, I think, to the diagnosis of autism. And so regardless of what the person's whole functioning looks like, if they are experiencing an impairment in quality of life that can be reasonably tied to the diagnosis, then I think we call it medically necessary. And so, this is why insurance companies, there are not acuity criteria, there are not deficit categories that have to be met or something. It's a provider has to assess that a child, can reasonably benefit from ABA therapy. And it's problematic, I think, from the payer perspective, because of course they're motivated to exclude people from services because that is more cost effective. But I don't think there's any reasonable way to do that in a way that, accurately categorizes people who carry the diagnosis of autism.
Great, thank you, Mindy. Our next question is about other therapies that are out there interacting with applied behavior analysis. Oh, Eileen, you're muted. Would you like to comment on that?
I apologize for that.
It's okay.
I'd be happy to comment on that. So I think that there are many therapies out there, and again, there's not one right way to educate all people with autism. If there were, it'd be easier for everybody, be great, but we don't have that. And so I think there are other interventions that can interact with applied behavior analysis. However, what I always want to look at is I want to look at what is the purpose of that intervention. Does that purpose make sense to the family and to the individual? Is it addressing something that's important to the family and to the individual? And all of the criteria that Mindy talked about earlier about judging ABA programs, I think those are fair to judge all programs. What is the interventionist working on? How are they teaching it? How do we know that the person will have learned the skill when they're done? And can that person use the new skill in a way that improves their quality of life? So, sometimes what happens is that you'll see a therapy and it may be called floor time, or it may be called embedded instruction, or it may be called naturalistic ABA. And you could look at videotapes of those three interventions, and you might not be able to tell the difference because on the face of it, they look really the same. But what's different about them is the theoretical background basis on which those interventions are based, and also some of the issues around how intervention targets are chosen. So I think that as interventionists, it's our job to work with each other to create a seamless support for the families. So if I'm a speech pathologist and the family has hired me, and they've also hired an OT, and they've also hired a BCBA, my job shouldn't be to tell the BCBA or the OT how to do their work. My job should be to work with those people so that we can support the family in the most comprehensive and seamless way. Thank you.
Great, thanks, Eileen. Another question, how much training do BCBAs and BTs get in speech pathology, linguistics, human neurology, and other related disciplines?
I'll take that one since I direct the Applied Behavior Analysis program at the University of Washington, so I know exactly what our students get. So our master's level students, so our students who are getting their BCBA, there's two levels of BCBAs, board certified behavior analysts. There's master level, and they are just called BCBAs. And then there are doctoral level BCBAs who you'll see a D after their initials. You'll see BCBA-D. That means they are at the doctoral level. Our master's level students really get no training in these things that are asked: speech pathologies, linguistics, human neurology. They get training in teaching communication because I mentioned that behavior analysis studies all human behavior and the principles that operate for all human behavior. And part of behaviorism is that talking and communicating is just another behavior and operates under the same principles as other behaviors. And so our students get a lot of training in how to look at communication as a behavior and increase it as a behavior. But speech pathologies, linguistics, neurology, they don't get. And so I think it's very important that they know that and that you know that. And we often strongly recommend that behavior analysts with kids who have speech and language issues, that the behavior analyst is working side by side with the speech language pathologist and collaborating together, just like Eileen was talking about the need to collaborate on other therapies. That's another therapy. And we as a field are really working on that. We actually just did a full day workshop in conjunction with the Washington Speech Language Association, the Washington Association of Behavior Analysts did, on how our two professions can collaborate together to get the best for kids. And I just think it's a beautiful marriage when you can have a speech pathologist and a behavior analyst working together to get the best from both worlds and working on a child's language and communication.
Thank you, Nancy. Our next question is about insurance. Is there anything in motion to try to get insurance companies to cover ABA like they would with more traditional medical appointments?
Yes. There's much in motion, and there has been for quite a few years now, luckily. I see that our colleague from the community, Arzu, is in the chat. So I am sure that she's going to be making some comments as well. So I encourage the asker of this question to also follow the chat. I can give you my perspective as a clinician. Arzu, who I'm referring to, runs an organization called the Washington Autism Advocacy Alliance. I always get the 3 A's mixed up, but I think I got them right. And she is one of the advocates in the state of Washington who has pushed for a lot of the insurance reform that we have had over the last 10 years. So she's a very, very knowledgeable source. But a brief summary of the question is there has been a ton of movement locally and nationally to have insurance companies cover ABA. Like I mentioned in my last insurance-based answer, in 2013, Medicaid in Washington started covering ABA. That was the result of a lawsuit for not covering. So the question was phrased, covering ABA like other medical interventions. And this was the basis for that lawsuit, that ABA is the intervention for autism. And so why wouldn't it be covered the same as any other medical necessary intervention for any condition? And this resulted in, the Medicaid program in the state of Washington beginning to cover ABA. What has happened in Washington since then is essentially that one by one, the other, large insurance companies that are based in the state of Washington have followed. Like Medicaid typically sets a precedent. Some had to get sued, others saw the writing on the wall. And for the most part, if not all, maybe Arzu can correct me in the chat if I'm inaccurate. I think that insurance companies that are based in the state of Washington now all cover ABA because they have to under Washington state law, which is the mental health parity law. But that is Washington specific. And so one of the things that sometimes happens is depending on who a person's insurance is through or who you work for, if your insurance plan is not based in Washington, it's going to be subject to the laws of the state that it is based in. And so, sometimes families will say, no, that's not true. My insurance doesn't cover. And it will be because their insurance policy, their insurance company is based in a different state. And different state, there is no federal mandate for coverage of ABA. And so different states do have different laws. But this has been a huge area of advocacy in the last 10 to 15 years across the US. And there's kind of a subset of the organization Autism Speaks, which is called Autism Votes. And they, on a national level, like that's a place where I often go for kind of just general updates on what's happening state by state. They have like a map on their website that, you know, will kind of say like, this one has laws mandating ABA, this one doesn't, or, but this is a huge area of advocacy. And if the asker of the question wants to be involved in the advocacy, you should connect with Arzu's organization. Or if you need help, you should connect with Arzu's organization.
Thank you so much, Mendy. We have a few more minutes and time for a couple more questions. One question we have is about the cons of applied behavior analysis, and if anyone can comment on those.
I'm happy to do that. So, you know, I think that you know, I always want to preface these comments by saying that, you know, I've been an applied behavior analyst for a very long time, and I'm very bullish on applied behavior analysis. But I think that you always have to think about what's best for your family and your child. And I would say it's a con for intervention for ABA if you feel like your child's not benefiting, your child's unhappy, you're seeing poor, you're not seeing progress with your child. To me, those would all be reasons why I would think that would be problematic. Now, what I would also want to say, though, is it an issue of ABA in general, or is it an issue with that particular therapist? And is it the method, or is it a match between that therapist? So when I think about the cons of any intervention, I always think it's important for the family and or the individual to say, what is it that I want to achieve from this therapy? Whether, you know, it's a young child or it's a teenager, you know, or it's an adult, you know, so even it's something that all of us, if we decide to engage in a therapy, whether it's physical therapy, occupational therapy, or even psychological therapy, we say, what is it that I want to achieve? So for the child with autism, well, I want to achieve better communication skills. I want to achieve some ability for my child to cooperate with family routines so that they'll sit at the table at dinner time, that we can solve some of our bedtime problems. What are those things that we want to achieve to help the functioning of our family? And then I think you have to say, who can help me achieve those? And if that's not a behavior analyst, it could be someone else. But I think knowing where you want to end up is going to help you get there.
That's great, Eileen. Where should parents go for additional resources or videos to learn more about what ABA looks like to help decide if it's a good fit for their family?
I can make a couple suggestions. I'm sure Eileen and Nancy might be able to also. A couple things that I often recommend to families. One is there is a video link on the University of Washington Autism Center's website, which people sometimes confuse with the Seattle Children's Autism Center, but those are in fact two separate entities. They have a link on their website that links to a video. It's not just about ABA. It's about a number of topics kind of related to autism, and it's kind of geared towards families who are just receiving the diagnosis and really trying to kind of, you know, get more information. But it has some really nice content in it about ABA that, again, I think is clear, it's family friendly, etc. So that is one place I often go. Not to like only focus on Seattle Children's as a resource, but the Autism 200 series, we do typically record the lectures and we archive them on the Seattle Children's YouTube channel, which I'm sure that our Marcom people can put in the chat, but also it's very easy to find if you search for it online. And there are a number of past lectures that are on a variety of topics related to ABA, and not all by our providers. So I would say, you know, there are a range of presenters, there are panels that have talked about different topics related to ABA. Those would all be, you know, talks kind of like this one, like an hour to an hour and a half. So that's a bit more of an investment, but somebody who's looking to go a little deeper, I think that is another, you know, useful resource of talks that can be watched. Eileen and Nancy, do you guys have resources that you would add?
Go ahead, Nancy.
No, you go ahead. I saw
Okay.
you just put something in there. Go ahead.
So I really love this website that's put out by the University of North Carolina, Chapel Hill. And if you just put in autism and FPG, which stands for Frank Porter Graham, you'll end up there. But it is a very, and hopefully someone can put that in the chat. It's got a fantastic video library. It has a whole list of evidence-based practices for students with autism. It's got a lot of very, very helpful information and easily and very easy to follow. So I find it very helpful for people.
Yeah, I think this is the same site that I was thinking of a series of modules called the Affirm modules that cover a variety of different topics and strategies, including ABA. So it's AFIRM, and you can look for the Affirm modules. Google that.
Great. Thank you so much to our panelists tonight. I'm going to pass it back over to Mindy.
All right. Yeah, we have about 2 minutes left. So I think that means it's wrap up time. Yeah, thank you everybody for watching. I could see in the chat that we had a lot of good dialogue happening and questions coming in. And it looks like we had quite a few folks online. So we really appreciate everybody's participation, and we hope you'll join us next month for Autism 204. I think probably most people know that this is a monthly lecture series, but if you were not aware, the schedule for it is on the Seattle Children's Autism Center website, and so you could see what each topic for each month is. So we will see you next month. Thank you.